started. So hello, everyone. Welcome. My name is Heidi Jacobe. I'm a dermatologist who specializes in sclerosing skin conditions. And I almost exclusively just see patients with morphea or localized scleroderma or systemic sclerosis in my practice. I actually don't do the things that most dermatologists do, like check moles. I just take care of people with sclerosing skin conditions. So one thing that you should know, just as a caveat, is I actually personally do not do the cosmetic procedures we're going to discuss, but I do routinely refer patients both to plastic surgeons as well as cosmetic dermatologists that I work with for cosmetic procedures. And so I'm well versed in terms of the types of things I feel comfortable referring patients to get, and then also obviously continue to see them afterwards, which is fantastic because my colleagues who do the cosmetic procedures don't necessarily follow up individuals over the long term. And so our learning objectives today are basically to really enable you guys and empower you all to recognize the changes of the skin that are due to systemic sclerosis. Having worked with a lot of patients and caregivers over the years, I've realized that a lot of people actually don't necessarily know the changes that are part of aging and the changes that are part of the systemic sclerosis that are changing their appearance. Also, I'd like for you to become familiar with treatment options for changes in your skin that you can use to address those that are specific to systemic sclerosis. And then we can also have a little bit of a discussion about changes that maybe not be that are not necessarily related to systemic sclerosis, but other types of things like, work on the nose and other things and how to think about those. And then it's also really important because if you have this background of systemic sclerosis, or for that matter, localized scleroderma or morphea, to really understand what types of providers you should seek out for cosmetic procedures. And I think that the spoiler alert is it's not going to be the person in the strip shopping center. And so we'll go through this. One other kind of bit of advice I have or to remember as we get started is because systemic sclerosis and morphea or localized scleroderma are both rare diseases, there's not a lot of studies in this space. So nothing I'm going to talk about is going to be something that is well studied, say in hundreds of people with a lot of information. So a lot of things I'm going to be going over with you is how I think about this and how I talk to my patients, and we think about these things together. So you can think about risk versus benefit for the procedures and figure out how to have those conversations in a well-informed way. And so there's a lot of changes that happen to the skin as well as the underlying soft tissue. So that's the fatty tissue, as well as sometimes the muscles as well, as a result of systemic sclerosis over time. And what you'll also notice is that different people have different degrees of change. And so some people will have much more marked changes to their appearance, while others have relatively minimal changes. And that also, the other thing is that this is also then going to be combined as you go through time with getting older as well. So there's oftentimes multiple different things that are contributing to the changes in appearance. And on top of that, you can also have changes in weight that can also alter the appearance of the skin and soft tissue. So this is just an example of the facial changes that you can see with people with systemic sclerosis. And you can see here, we not only have the changes that happen with systemic sclerosis, but also over time as people age. And so you can see here, starting off early in diagnosis, oftentimes you have kind of the skin is a bit tighter around the face with a shiny to it, and oftentimes you actually have decreased wrinkles. But what happens both with time and also sun, So I'm a dermatologist. So there's also a component here of sun damage. So just like everyone else, it's really important for you to protect your face from the sun. Daily facial sunscreen with at least SPF, hats, and things like that. So that's part of what's going on here. And then on top of that, you start seeing the changes of systemic sclerosis. And what are those specifically? So let's see. I don't see a pointer device in here, so I'll just come over. Well, okay, I can't because you won't be able to record me. So, okay, can you guys see this? No. Oh, okay. Thank you so much. I appreciate it. So if you look at panel B here and you see for our woman, oh, thank you. You're being so sweet. That's awesome. You can stand up. I feel bad. So you can just stand up and point. You can see that she has a lot of wrinkles kind of around her mouth. And those are called perioral rhytids. And those are actually a result of the systemic sclerosis affecting the area around the mouth and especially the musculature around the mouth. And you can also see she continues to have kind of this lack of wrinkling in the face. So this is also from the excessive collagen that can be part of scleroderma affecting her face as a whole. And then you can also get a loss of fullness of the face, which is a combination between age and then also the loss of the fatty tissue related to the systemic sclerosis changes. And we're starting to see just the beginning on the cheek here, sorry. And that's a mat-like telangiectasia. And we know when we start seeing those that people who get those on the face and also sometimes on the chest and hands and gums, that means the condition has been present for several years. And as you move on, you can see that you see more of these mat-like telangiectasias and you can start seeing them on the neck and chest. So, and this is, again, people are all different. So not everyone is going to go through this progression. So this is just one example. So to summarize, the types of changes that you can see over time in systemic sclerosis are this very tightened mask-like skin. So initially it appears to have less wrinkling. You can also have the changes in the tip of the nose. So you get this kind of more pointy type nose. You can lose some of the fatty tissue under the skin, so the fullness of the face. You can have decreased ability to open the mouth and wrinkling around the mouth. And then we talked about the mat-like telangiectasias. So if you take this in combination with damage from sun and aging, it can cause issues that have people concerned about the appearance of their face and how it has changed. So our first takeaway is all of this is made worse by sun damage. So the first thing you can really do is to be sure to wear your sunscreen and your hat. And then there's some things that we'll get into that you can do specifically for some of these changes. And what we know is that these facial changes actually have substantial impact on some people's quality of life. So I have had patients describe to me that they feel like they don't look like themselves anymore, that this has been also disability related to opening their mouth can make it very difficult to just brush your teeth, eat sandwiches. Dental care can be quite difficult and painful. So we know that these changes really deserve attention and treatment. So let's talk about some things that we can do. So one of the things that I personally like a lot, and I work with plastic surgery for this, is autologous fat transfer. And so what you can do is you can actually take fat cells from, around your abdomen or hips, and they can be treated in various different ways. And so some people like to do fancy things with adding all kinds of fancy ingredients and kind of like really massaging the fat cells. Others just take them and they go through a cleansing process and they're re-injected. But this is something that I have found at least to be very well tolerated in my patients. They have few permanent sequelae from this, and it oftentimes produces a very natural result. I use it more for the facial changes that we talked about. I have referred a few people for injection for the hands. I don't advise that as much. I have not found it to be as helpful, but I have found for the facial changes, it can be quite helpful with very natural results that tend to be long lasting. And a lot of people ask me, why not fillers? And the reason why is because one is that fillers are quite expensive. And so oftentimes, especially if you have a loss of a lot of the tissue on the face, the volume of filler necessary can be very, very expensive, and they're not permanent, unlike fat transfer, which oftentimes is. The second is my colleagues who do the filler actually with systemic sclerosis, the layers of the skin tend to be kind of stuck together. And what you're doing when you inject fillers is you're looking for a plane to inject the filler into so it goes in smoothly. But if you have the layers of skin stuck together, it's oftentimes more challenging to have it go in very smoothly. Now, again, it depends from person to person. If there's fairly mild changes, filler might be great. And if you're willing to repeat the procedure or try it out in a way that it's not a long-term commitment, it does work well. Now, you might also find that in the literature, people talk about that taking fat from a relatively unaffected area of the body and putting it in a new area has some sort of therapeutic benefit, aside from just bringing fullness to the face. I actually, trying to be diplomatic, I caution you against thinking of fat transfer as a therapy. It really is not in any way a therapy other than to address the cosmetic issues of concern. So you still need to follow up with your rheumatologist. You still need to follow up with your medical doctors. You still need to take the medications that they prescribe, because this is certainly not curing your condition. And unfortunately, there are some things out there in popular culture that imply that that's the case. And so again, I do a lot of this. Also, not necessarily the topic here, but for my patients with localized scleroderma, either the incudescent lesions or hemifacial atrophy, this is also my go-to. And if you work with a good craniofacial plastic surgery, they can do this and do a really nice work. And you can see here, you can harvest fat using different techniques, and then you can also then process it in different ways for it to be ready to be injected again. Now, the one caveat or problem I have found is if you don't have a lot of fat for them to harvest, this does not tend to work. And so you just need to be sure that you actually have some fat to work with in this space. So you can see here, this is an example of a patient, and this is typical of a lot of the results we can see. And so you can really see here, this shows where the fat was injected for her. And then you can see an A and C, the before and after. And you can see it can really address some of this wrinkling around the mouth, the lines that you see here, the fissures, and then restore some fullness to the face. And I think that this is not, you know, a hand-picked, really extraordinary result. This is something that I do see with my patients, and they tend to be very happy. And for a lot of people, this stays this way. They don't lose it again, which is the difference between fillers, which of course you have to repeat. And then here, this is another example of fat transfer, in this case, performed more around the mouth for this individual. So also sometimes the loss of the fullness of the lips is quite a challenge for patients. And you can see here in this individual, she really lost the fullness of her lips and had a lot of wrinkling around her mouth. You do get some swelling immediately after the procedure. So this is B. And then when everything goes down again, you see she lost some of that fullness. But the thing is, oftentimes, with my patients, they usually are getting the fat transfer twice, sometimes 3 times, but oftentimes once is not quite enough. Some people are happy after once. They say, this is great, I'm not going back. Others say, you know, I need a little more finessing, so they go back and get another one. But you can see, again, these results look very natural. And so then similarly, if you have localized or craniofacial morphea or localized scleroderma, the fat grafting, we do a lot of this in my patient population. Now, the big thing here is I like for patients to be inactive, at least on treatment. And we get this done. If they're really bothered by it, we just make sure they're on treatment and inactive, and we follow them very closely afterwards. But you can see here again, if you look especially at this angle on the left in panel D, you can really fill in the fullness of the face. And again, you see it looks quite natural, which is, I think people like that as well. So in this case, it doesn't look like you've had a ton done to your face. So we talked about this a little bit already, and this is probably the number one question I get in this space is the fat transfer versus filler questions. Also, a lot of people ask me with fillers if it's okay because they're concerned about somehow creating an immune reaction to collagen. So the thing to know about modern fillers is they are not made of collagen. They're actually made of what are called glycosaminoglycans and other things that are in the skin that are not related to collagen. So there's really no worry that you are going to somehow activate an immune response against collagen for modern filler products. There are some benefits because fillers are done as an outpatient procedure, and then there's a commercially available product. So if you don't have a lot of fat, you don't have to worry about that. They generally have a very minimal recovery time, but this is a little outdated. Some of these fillers now are lasting 12 to 18 months, but you do know you're going to need a repeated procedure. And as I said, depending on the volume that you're needing and the amount of improvement you're needing, this could become exceedingly expensive. Now, if you're just looking to plump your lips or maybe plump the lines around the lips, that might be more feasible with fillers, but kind of the full facial higher volume is better done in terms of a fat transfer. Now, there's some downsides to that because this is done often in the operating room where they harvest the fat and re-inject it. As I said, you have to have enough fat to harvest. There is some recovery time. My patients tell me actually where they take the fat from can be quite painful, not so much where they inject it. And as I said, usually people need 2 procedures, but the effects are long lasting. So that's a good thing about that. Okay. So other injections for facial systemic sclerosis. And so my colleague in dermatology does a lot of this, and I work closely with her. She has a real interest in cosmetic procedures for medical indications, not purely for cosmesis in individuals who maybe don't have an underlying medical condition. And so she uses a lot of Botox for the treatment of both the decreased ability to open the mouth, which is what we call decreased oral aperture, as well as some of the wrinkling around the mouth. In addition, we have used, interestingly, a medication called hyaluronidase for treatment of decreased oral aperture. And what hyaluronidase is it's actually used in people who have overcorrection from fillers. So if someone gets a filler in their lip and their lips are like humongous, you know, like you see on social media, and they're like, I hate this, like, can you take it down for me? You inject hyaluronidase to get rid of the filler. So we found, interestingly, that hyaluronidase can actually also sometimes help with softening this area around the mouth and increasing the ability to open the mouth. So my colleague sometimes uses a combination of Botox and hyaluronidase both to try to address some of the wrinkling around the mouth and then also relax and increase the ability to open the mouth. Now, this is not going to be dramatic. So, you know, if you're really having restriction in your oral aperture, you might get like 0.5 centimeter out of this treatment. But for some people, it does feel that they have a little bit more motion. We can then also use filler or fat transfer to further address the wrinkling or furrowing around the mouth. And then we also can use laser treatment. So you might have seen at the beginning, some people get those what are called mat-like telangiectasias. So those are going to be the little blood vessels under the skin, and those can be treated with laser. The thing to remember is it's really hard to treat all of them. So oftentimes you are going to have to choose, you know, the area that bothers you the most, and also understand, unfortunately, the thing that's driving you to get those, the systemic sclerosis, is still there. And so you likely will continue to get more over time. So we won't be able to prevent those. And laser treatments are going to require multiple treatments over time to address this. So let's take a look at a couple of photos. This is actually a procedure that we do not do a lot of at UT Southwestern, but has been reported in the literature, which is what is called fractionated CO2 lasers, So this is also known as a Fractal Laser for decreased oral aperture and wrinkling. What this does is actually the way it works. The fractionated lasers actually poke microscopic holes in the skin. And they are supposed to then, they're also used just for photo aging, so aging from the sun and sagging skin from the sun. And they poke the microscopic holes into the skin, and they are supposed to cause remodeling of the collagen, and that's why they're used for just plain old aging skin. And the thought here is that this causes some remodeling of the collagen that improves some of the wrinkling around the mouth, as well as helping increase the oral aperture. You can also have the option here. Some people will use a liquid steroid. Some of you might have used a steroid cream, and once after they do the procedure, they actually put the liquid steroid in here to try to increase the anti-collagen effect. As I said, this is not something we do a lot of at UT Southwestern. I would have concern about this. You also have to be worried about reactivating if you get cold sore, so you need to be on suppression for that. I also have concern about this in terms of just healing. So not something I would recommend. If this is a problem for you, I would go much more with what I've discussed already, which is going to be the Botox, the hyaluronidase fillers for just small areas, and fat transfer for larger facial areas. This is actually a really nice thing because the Pulsty laser can be really helpful for the telangiectasias. The thing that oftentimes is distressing to people in this case is you will get bruising after this, because what this is actually doing is this laser sees the iron in your blood, and so it's preferentially finding the iron in your blood, and it's kind of like just targeting that and heating it. And when it heats it, what it actually does is it kind of blocks off these little tiny blood vessels that are making these mat-like telangiectasias. And so they also bleed a little bit. So people get a lot of bruising after this procedure. So there is some recovery and downtime for the bruising to improve. And as I said, this is not going to be this outcome here is not after one treatment. So you are going to sign up for a number of treatments over time. And then again, you know, some of these original ones can come back over time, or you can get new ones over time. So this is likely something where you would have to consider some maintenance treatments to maintain this level of improvement. So this is another issue that we see a lot of, which is salt and pepper pigmentary change. Very distressing, especially for people who tend to have a darker skin type to start with. This can overlie areas of sclerosis, but it can also occur in areas where you don't have a lot of the sclerotic skin change, and very distressing for people. And so one of the treatments that we have at UT Southwestern, which is not widely available, but there are several centers now, Scleroderma centers that offer this, which is UVA1 phototherapy. And you can see here in this patient who had childhood onset systemic sclerosis. She had just kind of graduated from high school, was very distressed by this pigmentary alteration. And you can see here, she was a little over 40 treatments in with UVA1, so we were able to repigment her skin. Her abdomen did okay, but she was really excited because her chest really repigmented a lot, and she was very happy because she was able to wear open shirts and things like that. So this is definitely something that can be treated. It is a very much a long-term commitment in terms of you're really going to be looking at 40, 50, 60 UVA1 treatments over time. And then you can oftentimes improve it, but sometimes we can't completely get rid of it. So this is, as I said, challenging to treat. Sometimes I've seen people improve with immunosuppressives, but not frequently, like things like mycophenolate mofetil or other treatments. But oftentimes it does not. And then UVA1 phototherapy is a good option. Unfortunately, it's not widely available, but most dermatologist offices will have narrowband UVA, and that might be another option to try to get repigmentation for the salt and pepper change. So let's talk a little bit about which procedures, kind of thinking about which procedures are risky, because unfortunately, there's no way for me to say, this treatment is going to be not have any risk with it. And even in people without systemic sclerosis, cosmetic procedures have risk and you can have complications. But it's kind of important to think about, in this case, what features of my condition are going to potentially make me have more risk than someone who does not have systemic sclerosis, and how do I think about that and have conversations with my providers about that. So there's a few general precautions that we tell people, regardless if they have systemic sclerosis or not, that should be a danger sign when you start thinking about procedures that are not medically indicated. I also want to clearly differentiate. There are medically indicated procedures, and what we've talked about are cosmetic procedures, and certainly some have functional implication. But I would never want someone to think, if you truly need a medical procedure, a surgery for cancer or what have you, that you shouldn't get it done. So to avoid procedures, if you have a tendency to keloid. Now, keloiding happens oftentimes in people with darker skin types, and it's an abnormal scarring response. This is different than systemic sclerosis, but people can have both. But we tell people in general, if they have a tendency to keloid, that they should avoid any type of traumatic procedures to their skin. Also, in cases of people with systemic sclerosis, there is a different set of stages that your skin condition related to systemic sclerosis goes through. And the first part of it is you can have some very inflammatory active skin. This is true in people with localized scleroderma, but it's also true with systemic sclerosis. And I do not advise any cosmetic procedures in this scenario for two reasons. One is inflamed skin is going to be very reactive to procedures. And then secondarily, you have an active ongoing process where potentially you can lose any benefit of the procedure and you're just going to end up right back where you were. So in these cases, it's really important that you work with someone who is going to be really good at medically treating your skin condition related to your systemic sclerosis. So the skin changes of systemic sclerosis, get those under control and get to a point where your skin disease is in remission or inactive, and then you start thinking about the cosmetic procedures. Also, there are certain areas of the skin of people, especially with systemic sclerosis, that should be treated always with care. So hands, especially fingers, both because of the sclerotic skin changes as well as the vascular changes that you see as Raynaud's, make anything on your hands or any procedure on your hands at risk to heal poorly. And so I tell my patients, if someone tries to freeze something on your hands, dermatologists, we love to freeze stuff. So we get little pre-skin cancers that we like to freeze. We see a wart that we want to freeze. I tell them, please do not let people start freezing things aggressively on your hands. And the further out towards your fingers it is, the more you should avoid it. I even tell people, we all love to go to get our manicures and things like that, which is amazing and it feels good. But I tell patients, one, bring your own tools that you sterilize at home. Make sure that the foot baths they are using, they put a removable, disposable plastic cover in them. And don't allow any kind of sharp cutting of your cuticles, because again, you're going to have an increased risk to potentially get infection or non-healing wounds with those types of treatments. And then obviously any area with calcium deposits. So the calcinosis cutis, those areas are very tender. They have a predisposition to be infected. So again, you would want to avoid any types of procedures in those areas. So the other thing is that I mentioned before, and it's worth mentioning again, because unfortunately there's some misinformation that's being circulated. And the important thing to remember is systemic sclerosis, as well as localized scleroderma, are multi-system disorders. And so these are really not treated by a procedure to a specific area. And so they do not replace medical treatment. So just worth saying again, one more time. So how do you find the right provider? There's a lot of people out there doing cosmetic procedures now. There's people who are not physicians. There's people who are all different types of specialties. And so in this scenario, I don't recommend going to someone without experience, no matter the individual. But in the scenario of someone with systemic sclerosis or localized scleroderma, you really need to look to find the right provider. And so what you want to avoid is any service that's provided without an actual dermatologist or plastic surgeon that is on site in part of a medical office. There's different laws in different states, but in Texas, for example, you can have a service provider that is doing fillers, Botox, a number of different laser treatments, and they have someone that is supervising, but that individual can be far away, 1,000 miles away in a different state. So you want somewhere that is actually run through a doctor's office, and you want to avoid anyone. I told you, I hope I've conveyed to you, there are definitely things that can be done. There are definitely things that can address these types of sequelae of systemic sclerosis, but none of them are going to be magical cures or dramatic improvements overnight. So if someone is telling you, oh, I just have this miraculous laser and your face will be great, that's always a good sign for caution. And then also those who exclusively are really offering you and starting off with very, very aggressive, highly invasive procedures, and who are not really giving you a good conversation about risk versus benefit, what the recovery looks like, how many of these procedures are they doing, is also a reason for caution. People who are really good about doing cosmetic procedures tend to be conservative and start with lesser procedures and move up. They also tend to be very realistic about the results and the expected recovery time. And so that's really what I have listed here. In the case of systemic sclerosis, it's really great if you are seen by a provider who has kind of sees a lot of patients with systemic sclerosis, because they oftentimes will work with within an academic medical center, or have a referral base at least of people who do these procedures, who hopefully they refer to routinely, so are experienced with and understand systemic sclerosis and localized scleroderma. And that's certainly true for our group. As I was saying, I have two colleagues who see all my patients in dermatology, and then I work very closely with a pediatric and adult plastic surgeon. So they see a lot of my patients and have a real interest in and familiarity with these conditions. And, they'll call me from the operating room and be like, hey, Heidi, I've got this patient here. Are you okay with doing X, Y, and Z? Anything I should be concerned about? That's the type of place you should feel most comfortable. So I'm going to end here. Because I know you guys have a lot of questions, and there's also all the other procedures that you can get done, you name it, tattoos, whatever, and we can have a conversation about those as well. But I wanted to focus in a lot on the facial changes and the types of things we can do to address those. So I'll open the floor for questions. So, yes.
It said on there, for lasers, consider a test spot option.
Mm-hmm.
Why? What could happen with the?
So in anyone, who gets laser treatment, sometimes A, it doesn't work. B, and especially in people where you're treating a darker skin type, especially for the telangiectasias, you can actually paradoxically, if your skin is darker to begin with, you can actually get a dark spot in place. So before investing, oftentimes good providers will do a test spot for either a very reduced cost or really no more than part of a consultation fee. So if you are spending a lot of money on a procedure, it's always good to make sure that, A, it's not giving you a problem, and then B, also that, if you pick just a small area, that you're seeing a benefit from the procedure. And then if there's any concern about healing, that also you can see at least how it does with a small area, and can feel more confident if you're then going to go for a much larger treatment area before you invest your money. I've encountered patients who have spent, unfortunately, a lot of these things aren't covered by insurance. So there's a large out-of-pocket cost, and they've treated their mat-like telangiectasias, and they really didn't like it because they're like, I look terribly bruised. It was really painful. I dislike the procedure. I don't feel this is so much better. And the experience of the bruising and the pain of the procedure was such, I don't want to repeat it. I'm sorry I ever spent money on it. So, I think it's always wise when there's a question that, you try it out before investing a lot of time and money in something. Yes.
About laser hair removal. Is that a big risk for waiting? So I've had, I always want to do it.
Yeah.
Yeah. So is that safe?
It should be, it falls under I think things that are probably not risky. If you repeat it 1,000 times, I can't say that no one will ever have a problem with it. If in doubt, that's a great spot for a test spot. That's a great scenario for a test spot because you can do like kind of a little small area if you're worried about kind of the peach fuzz or, on the chin or depending where you are. My only caveat, people don't normally laser like their fingers because they don't have fair, but I would not say do not do anything to your fingers. But, but otherwise, I think especially again, if your skin disease is inactive, it's probably okay. But again, a great place for a test spot.
And then just another question, red light therapy, is that safe?
Yeah, like the masks. Yeah.
Or even they like machines.
Yeah, yeah. It feels really good. Yeah, I think actually those are fine. There was actually a study I saw. I don't think anything ever came of it officially with infrared and red light therapy actually is potentially a treatment. And so I think that that's unlikely to be harmful. And I have a lot of patients in the red light and the infrared where it feels really good. Yeah. So that is something I think that is probably something that you can do that's going to be low risk. So, yes.
My question, I can't say the word telangiectasia.
You've got it.
Okay.
Yeah.
My dry eye doctor, he's an optometrist. He said that I have it on my eyes, and they want to do IPL. Are there other treatments for it on your eyes, or is that?
So they want to do intense pulse light around your eyes?
In my eye, yeah.
I'm not familiar with that.
Okay.
Yeah, I would definitely seek a second opinion of an MD eye doctor about that. I've never heard of that or referred anyone to get anything like that done. So I would definitely get a second opinion. Yeah. Yeah. So, yeah. So we touched on that. And the one thing I didn't address, there's also like the radio frequency treatments as well that in theory could help. And some people, I see some people nodding in that space as well. So the Fraxel laser we talked about is more for the lines around the mouth, potentially, as well as helping with opening the mouth. I will say that I think that the Fraxel laser for lines around the mouth, notice here they have everyone with this, as I said, I don't do this myself, and notice everyone has their mouth open. And of course, if your mouth is open, you don't see the lines as well. So I think these photos are fooling. I do not think that the Fraxel is going to be great for getting rid of lines around the mouth. Now, this implies that people were better able to open their mouth because this is the before and after. But I don't think this is going to be great because it's not even great for wrinkles. You get a little bit of improvement, but not a ton. I think if you're worried about lines around the mouth, your best option is going to be some combination, depending again on how much you're doing. If it's a larger amount and more full face, it's going to be fillers. And then if you just want to increase the fullness of the lips and the lines and are okay with repeating it, fillers, and maybe some Botox as well mixed in, like that combination is going to be better for the lines around the mouth, in my opinion, at least.
So I tried the fat and it just breaks off.
It did.
And, do you think that I would have, I understand the fillers are temporary, but I don't know. Did you see people that
I've had people who have done that where they've lost some of the fat and they just didn't want to go through the procedure again. So they did get fillers done. And that has worked for them as well. I think where I see people tend to like the fillers is for kind of helping with increasing kind of the fullness of the lips, and then also, some of these wrinkling around the mouth. So it's worth a try for sure.
Like decrease the dental work where he's gone to the over, or is it more about reducing the fat? Like, because I'm seeing a lot of like the teeth become black.
Mm-hmm.
And I was talking to a dentist and he was saying she has to get braces anyway. And I was like, is that going to make the situation worse? Or is it going to make her appearance more something she would like?
Okay. Yeah. Is this, so this is a child?
Yeah, this is my daughter. She's 10.
Okay.
So she's about at the point to need braces.
Mm-hmm.
Her teeth are definitely becoming more apparent because backward,
Yeah, and sometimes you do get those changes where you really see the
Yeah.
teeth becoming more prominent.
More prominent. So
Yeah.
talking to her dentist is like, oh, push your teeth back. That's like that makes more better.
Yeah, that's a hard question because, sometimes I also recommend removing teeth just because of alignment issues, but I would be a little concerned in that space. I do know also there's bigger, oral maxillofacial issues beyond the cosmesis, and there's the functional piece as well. So you might want to consider getting an oral maxillofacial surgeon involved. I find that they can be helpful in that space because there can be bony changes as well that underlie that. And this is, your child has systemic sclerosis, or?
She has, yeah, she has.
Yeah. So yeah, I think that can be complicated. Usually in that scenario, I really work with also oral maxillofacial surgery to address some of those issues as well. So it's much more of a team effort because there can be functional issues. And I've had people who've had different procedures orally in terms of addressing some of that as well. So, sure. Yes. So again, I want to be cautious because it would be hard for me to give specific recommendations without seeing people. But just in general, I guess this is for limitation of range of motion. It's not a procedure I do routinely in this scenario. It's definitely a difficult problem. I tend to work a lot with physical medicine and rehabilitation to try to address some of these issues with physical and occupational therapy. I also sometimes work with orthopedics as well. So I don't want to give specific advice because I don't know his specific situation as well. So, but I think, what I generally advise, if you can access someone, I also think getting multiple opinions is a really great thing to consider here. And again, trying to work with your rheumatologist or dermatologist to get a referral to someone who has experience in this space, who's willing to communicate back and forth about what's going on is a really good thing. But I'm sorry, it's hard for me to give specific advice without having seen him. So. Yes. Well, so that's an interesting point. I don't know. Has anyone seen men get these lip lines? So, well, I think not as many men, right, have systemic sclerosis. So it's a minority. But yeah. So, well, the thing also too, that we talked about that there's a combination of, the evolution of the systemic sclerosis over time, damage to the skin from the sun, and aging. And in women, that actually menopause causes a whole slew of changes in your skin. And men don't have that, right? And even with hormone replacement, what's interesting is if you replace estrogen, it doesn't necessarily change the aging in the skin either. That has to do with menopause. And so I think for us women, unfortunately, what we're getting is a whole slew of all of that together. So more yay, lucky for us women. So yes. So yeah, so this is actually a really important point. So thank you for asking that. What's absolutely critical to keep the fat transfer is to make sure that the underlying condition is inactive. So oftentimes that requires determining if there is ongoing inflammation and treatment with a systemic immunosuppressive. Because if you have the process ongoing, you're just going to lose the fat that you transfer in, similar to how you lost the fat originally. And I've had quite a few patients like that. One I just saw recently, and she had the same thing. She's actually had fat transfer 4 or 5 times and always lost it. But we treated her with an oral immunosuppressive medicine called mycophenolate mofetil, and did that. And after she had been on it, I think she was on it for about a year, we worked with a plastic surgeon to do a fat transfer. And I just recently saw her, and it's been a year and a half, and she's maintained the fullness of the fat transfer. So sometimes when that's happening, it might be an indication that there's an underlying level of activity. So again, hard to say without having seen your son, but my experience is, at least if it's inactive, people tend to keep the benefit of the fat transfer for many, many years. But that's why it's so important to work with a medical rheumatologist or dermatologist, as well as the plastic surgeon together, to make sure that you're treating what's going on underneath that's driving the changes, because otherwise you're going to lose the benefit of any procedure as well. So.
What filter do you recommend?
So yeah, there's a whole bunch of them, and there's more coming out all the time. So the fillers, there's different fillers, both in terms of how long they last, and also for the specific what you're trying to address, whether it be the fullness of the mouth, the wrinkling around the mouth, as well as, like for example, the lines here, or if you're injecting elsewhere. So the best thing to do is to have a conversation with the person that you're talking to, just about the benefits versus pros and cons of each of them, in terms of how long they last, what it will look like, etc., in terms of finding the ones that are right for you as well. So, yes.
I have a question, and I don't know if this is something you've been studyed, but as far as like makeup tattoos on the face, right, because for hands tight, putting makeup on is hard. Is that something there's research on, like eyeliner?
Yeah, yeah. I cannot tell you. Everyone loves to ask me about tattoos, either on their body, right, or on like the permanent makeup tattoos, like the lip filler, like the lip liner and stuff like that, and then the tattoos on the body. And unfortunately, there's no research on it that I'm aware of. I think, again, this goes under the heading of if you're in a place where you've been in remission without a lot of activity, I would try, before getting, your eyeliner and your eyebrows and your lip liner and your lipstick and like a bunch of stuff done, you might try just a small thing before you go all out. But it is something that I would say for a lot of these, it's frankly kind of in the space of the relative unknown. And I know we had a question about just plastic surgery on the face, like the procedures on the nose and such. It depends, because we talked about sometimes you get those changes in the nose related to the systemic sclerosis. And so a lot of that depends on the tightness of the skin over the nose. And also some people can actually get, you can have the similar vascular changes in the nose, like on your fingers. And so you want to be really careful because you want good blood supply for that. So that's going to be very much a case by case basis, because if your skin is really tight over the nose here and you have resorption and loss of some of that cartilage that makes your nose, and you have a tendency towards a lot of vascular issues, it might be a problem with healing. So that would be something I would definitely proceed with caution for people. So again, you want to start with kind of the milder, if you will, or lower risk options before going with those more intensive procedures. I think we were at time. I guess we'll do one more question.
Like serums that say by collagen.
Yeah.
Is that something you could use, or would you stay?
Oh, you can totally use it. And people ask to, I should tell you guys, people, they have all the collagen, like the bone broth, and drink the collagen. So your skin is kind of set up to actually not absorb that very well, as is your gut. so it is unlikely to be harmful, but it probably, frankly, might not be all that helpful for you either. So, but it definitely falls under the unlikely to be harmful category, either like a cream with collagen or ingesting collagen, because actually your whole GI system is kind of set up to break that down, and your skin is kind of set up not to absorb it very well. So, but there's really not a lot of evidence that exposure to collagen itself activates systemic sclerosis either. But yeah, so any other questions? Anything else you guys heard about? Okay.
Well, I have one more question about the fat transfer. So, after a dermatologist, and so is that just, that's where I start the conversation?
Yeah. Yeah. Most dermatologists don't do fat transfer, and I'd be worried about one who told you they did. So, but they could refer you to a plastic surgeon. Yeah.
So I've got puffy lower eyelids, some prednisone that they're all on before I was diagnosed, and that never went away. So it's had prednisone. Can I go with a laser or something there to take this puffiness down? Is there something?
Yeah, so that falls again under we don't have a lot of data, but unlikely to be problematical. For that, there are people use the Fraxel CO2 as well as the radio frequency procedures to try to tighten up the skin around the eyelids. I think both of those would be probably pretty low risk, especially if your skin disease is in remission. And those would be the less invasive procedures. Now, you can actually do plastic surgery and tighten up the skin of the lower eyelids. I generally, similar to the getting the rhinoplasty, the work on the nose done, I generally don't recommend that because of poor healing, and also if the skin tightens up too much, you could have problems actually closing your eyes. But the milder treatments in terms of the fractionated laser treatments or the radio frequency to tighten it up a bit might be good. Some people also do filler, like just here to kind of fill it in and pull out some of that to even it out is sometimes also, again, that's not going to be dramatic, but it can help decrease the appearance of it. I think also if you're tight here, it's going to make this part relatively more puffy. So
Puffy is in the baggy or sagging that it got.
All right. Well, thank you so much, everyone, for your attention. And we definitely need more research in this area because we just don't have a lot of data. So I hope this was at least helpful to frame how you think about this. So thank you again. Oh, okay, yeah, I won't mess it up.
I've heard about people trying Botox in their hands for dry notes.